Good morning, everyone, and good evening, some of you. We'll begin the session soon in next 2 minutes. I'm just waiting for everyone to join the class. Okay, let's get started, everyone. Good morning once again, and good evening, some of you. Right now, I'm joining from Canada. My local time is almost 11 o'clock in the night time. And those students who are joining from Asian part of country, so good morning once again to them as well. Now, just a quick little bit reminder before we start the session on anything today in the cardiovascular, just in case if I leave the room for 5 minutes. So just try your best to understand my situation at that time, because most of you already know this thing that I might leave the room for 5 minutes in case that could be because of my little baby sleeping in the next room right now. But hopefully we will be done before he gets up sometimes in the middle of the night, right? Now, in today's class, this is going to be a very interesting lecture because we are starting the cardiovascular system today. And in cardiovascular system, remember everyone, this is not going to be only just one lecture today because cardiovascular is so huge, right? So we need to cover like all the important medical conditions also, and we need to cover all cardiovascular meds. I cannot skip any single cardiovascular med because every cardiac med is very, very important. And then we are also going to cover ECGs. We are also going to cover electrolyte imbalance as well after. So not today. Right now, I'm just telling you what is coming up in the series next time. So you will be very much aware about it, like what is going to be happen next, right? But in today's class, I'm going to discuss pretty much about the medical conditions of the cardio, right? Now, I do understand some students, they feel like cardio is very, very difficult. I personally feel cardio is a little bit easy if you try to understand in an easy way. Okay, just try your best to understand. And maybe if you already have a good knowledge, so that's good. But those students who find cardio very, very difficult, so you can try your best to understand with me here today. And there is always a chat box available in YouTube and also in Zoom as well. This is a free class, everyone. So feel free to participate in there. Ask me doubt, any question during the class, after the class as well. Okay. In today's lecture, what I'm bringing few medical conditions today. And I'm also going to bring some practice question at the very end. Okay. So stay until the end of this lecture today. So you can see some questions with me today, how to practice those NCLEX style questions, mostly NCLEX style because a lot of students demanding for NCLEX style questions. But if someone is joining here for any other nursing competitive exam, like NORCET or maybe any other competitive exam as well, maybe even if you are a nursing student, this is still going to be helpful for you because you will learn something out of it, right? So try your best to stay connect until the end of the class and ask me any doubt, any question which you have with me, okay? The only little reminder for everyone not to use my screen, please. Please erase everything because sometimes I know some students, they try to come and they try to draw something on my screen. I always tell everyone in my previous classes also, I'm not really a technology person, everyone. Very simple human being. And I just know this presentation, how to run on the Zoom. So try your best not to write down anything on the board, okay, while I'm talking in between, because that's interrupting someone in the class, okay? So now let's get started with the cardiovascular system. So before we learn anything in the cardiovascular system, what I think is personally, we need to know a little bit story, before you do any medical condition here today with me. Now, which story I'm talking about? It's a very simple story, what I'm going to tell you, because if you understand the story, you will understand the relationship of all these diagnosis condition, which I'm going to talk about today, okay, in very simple language. So the story is, how to say is, let's say I I live like in a house, for example, right? And that house is actually have lot of, you can say, water pipes, right? Now, what if my water pipes get blocked? Not the blocked actually, maybe first, let's say some of the pipes, they're not working enough, right? Why? Because some of the pipes, they get so much dirt inside, right? So they're still working, but not working good enough the way it should be, right? So that first condition happened in my house, right? And after that, obviously, when that dirt is, getting into the pipes in my house, right? What is going to be happen next? Blockage, right? So one of the pipe, or maybe all the pipes, or some of the pipes, water pipes, they can get blocked, right? Now, when they get blocked, obviously they will create some problem for me in the house. I'm not going to get the water maybe the way it should be, right? So definitely I will be freaking out and I'll do something for that, right? So that is another condition now in my house. Now, after that, once the blockage, everything is happening in there, um, I call someone and I try to fix those water pipes, right? Why did I call someone and get it fixed? Because I need the water in my house, right? And I want a clean, nice water, which is helping me, my family also, right? So I call someone and get some pipe fixed, right? And once it's get fixed, it's working, but it's not that way working now because my pipe seems like they get little bit, like a bad in condition, but still okay. They're working now. They're tired and they're weak, right? So this is something I want to tell you a story first. Why did I tell you that story now? Because now it's easy for you to understand these medical conditions with me, right? So let's talk about, again, in a simple language, What is the difference now between all these conditions? Before we study them more in detail about them, you need to know the simple meaning, the simple language first, right? Because otherwise, everyone has a book. You can read definitions in there, right? But if you don't understand the meaning, you don't know what you're doing in there, right? So the one I'm highlighting right now, I'm going to talk about them actually in here, okay? So the one I'm highlighting right now is these three so far, and then the fourth one, right? So four conditions I highlighted for you. Let's see what is the difference now. What is happening into there? And why did I use a simple language earlier, like a water pipes and everything? Let's correlate them. So the first condition we have is the coronary artery disease, right? What is coronary artery disease? Simple meaning, simple language. The heart has a coronary arteries on the top of it. When those arteries become narrow in size, why they become narrow? They get some fatty depositions like plaque and everything in there, right? And then those arteries definitely not working good enough right now, the way it should be, but it's still working. It's just like deposition in there now, like a plaque formation, right? So that condition we call coronary artery disease in a simple language, but we will study more in detail about them in the next slide. Okay. So remember the story, the one I just mentioned earlier, the water pipes in my house like get dirt little bit in there. So this is how you can remember like plaque formation is in there, right? And the water pipes you can correlate coronary arteries, right? So your coronary arteries is basically in there. And the house, which I give you example, you can consider that as a heart, right? So the heart has a coronary arteries, and that arteries get plaque formation. And because of plaque formation, creating further problems in there. So you're not getting again the enough supply of the blood and oxygen the way it should be, right? So that condition we call is the coronary artery disease. Now, the second one I want to correlate with the story, the one we have in China. Remember, everyone, angina is not an actual, I know in the books sometimes they tell you it's a diagnosis, but it's actually a symptom. Okay. Angina is nothing, chest pain. That is another meaning of that, right? Now, why this symptom started? Why this problem started in China? When the heart is not getting enough oxygen, right? And why not getting enough oxygen? Maybe multiple reasons. Maybe there is a plaque formation there, right? Or maybe the blood supply just reducing down, maybe some blockage happen, which I'll talk about in the later on now, right? So basically, the heart is not getting enough oxygen, and the heart produce further, an acid. That acid we call lactic acid, which makes the person to feel chest pressure, chest pain. And that pain we call in a medical language is angina pectoris, right? Pretty simple, pretty easily, right? Usually it do not cause any damage to the heart muscles and tissue. It's just like comes only for some times, right? But when it stay permanent, I'm going to talk about the next stage, right? So basically, the next thing is what going to happening in here is once either plaque formation, maybe someone got angina, a chest pain suddenly, right? Now, if someone got a lot of blockage in there in that artery, remember I mentioned earlier in the water pipe, if there is a lot of blockages happening, right? Complete blockage, you can say, right? That make a condition again. Which one? Heart attack. Common word we call heart attack in common language, right? But the medical term we call it myocardial infarction, right? So myocardial infarction is nothing. It's just basically your artery get blocked, right? The coronary artery, one of your coronary artery get blocked, or more than one of the coronary artery get blocked, and it's a complete blockage is in there. Now the heart is not getting enough oxygen again, and definitely the further symptoms will be started, which I'll talk about in the next slide, right? And after that, as it's also mentioned here in the flow chart pretty easily for you to understand, like when there is a plaque formation in the arteries, definitely it reduces the blood flow as I said, right? Now, when it reduces the blood flow, or let's say maybe someone was in the myocardial infarction before, right? Now you try to treat and open the blockage everywhere, and you try to treat the heart, your heart is still going to become weak, right? So remember when I said I called someone for help in my house, maybe a plumber or somebody, and they try to fix it for me, right? And after fixing it, it's still not the way it's supposed to be because it's getting tired and weak now, right? So that condition we call heart failure, right? Heart failure is nothing. Heart failure is just like your heart is not pumping the blood enough now the way it's supposed to be, even after you get treated the MI. So in a very simple language, you can say someone can have coronary artery and they can have further angina. Even let's say there is no coronary artery disease, it start with angina because of different maybe risk factor, which I'll talk about in the next slide. Angina patient or coronary artery disease patients, these patients can go into MI if you don't treat it on the time, and the MI patient can go into the heart failure if you don't treat it on the time, right? So everything is so correlated and very interesting if you make it interesting as well, right? So there is no doubt in here, right? Because it's pretty simple and pretty easy chart, but let's try your best to understand more with me in again in a medical term languages as well, and see if that making more sense. And then you also let me know in the chat box. I'm live also on YouTube right now and also in the Zoom classes. If there is any doubt, you can always use the chat box for me so I can respond it back to you. Now, let's talk in detail first condition, which is coronary artery disease, right? As I said, coronary artery disease is what? Nothing. It's just the narrowing of the artery or obstruction of the one or the more coronary arteries because of the atherosclerosis. Not a complete obstruction, it's the partially obstruction usually happen here. So I want to let the students know about this one too. Now, when this happen, this obstruction happen or narrowing happen of that artery, as you can see, this is a pretty good diagram I can see here. It's a lot of coronary arteries they show you in here, and this is the size they open up for you of the one of the artery, and you can see plaque formation here inside, right? And due to plaque formation, this yellow, right, definitely reduce the size inside, blood supply will be reduced now, right? So definitely if this is happen, it decrease the perfusion to the tissue, right? So your tissue is the myocardial tissue is not getting enough oxygen now, right? So inadequate supply of oxygen will be there, and that creates the further problem. Which one? High blood pressure, right? Because the blood which is coming from one side of the brain and trying to go, the going from the one side of the artery, it's trying to going towards the other side, that definitely it will try to push harder now because it's not going properly, right? So the high blood pressure can be expected. Patient will have the chest pain at some point because your patient is like, I'm not getting oxygen in my heart. I'm not getting oxygen in my heart. So definitely the heart will try to pump faster when the heart is like this, right? The heart is not getting oxygen. So the heart will try to pump faster. When the heart will try to pump faster, what is going to happen? Tachycardia, right? And your patient is then going into dysrhythmia also at the same time. And if you don't control it, this patient can go further into MI, even the heart failure, even patient can also have a death if we don't treat this condition on the time. Right? So I hope it's pretty simple, pretty easy language, not very complicated, right? Now, along with the medical conditions today, everyone, we are also going to discuss some procedures also, just so you know, and some important diagnostic test information. When I see something on the way, we'll also discuss them at the same time, okay? So when you have a patient coronary artery disease, what are you going to check in that patient? How do you know which symptom you look into? How do you know this patient has a CAD, right? First of all, remember, sometimes we don't know the patient has a CAD. Why? Because if it's just something tiny initial stage, and the patient not presenting symptom, until unless you send this patient to laboratory to do some further testing, then you get to know about their heart condition, right? So for example, if I by myself, right, let's say I'm eating like junk food every day, for example, right? And then one day I don't have any symptom, even if I'm eating the same food, right? Even if I have a little bit, let's say one of my artery get a little bit plaque formation already in there, right? But I don't have a symptom. So you don't know I have a symptom until you see that in the laboratory test, right? But sometimes you see the symptom on the client face when the patient is already now in the acute stage and is trying to showing something to you. And when this is trying to showing something to you, when ischemia happen already in the myocardial tissue, right? So they will show you like problem like chest pain, as I said, not getting enough oxygen. That's why chest pain is there. And the palpitations they will feel, they might gonna tell you, I'm not breathing enough. And they might feel some blackout, some syncope as well. Might can cough also at the same time. And their cough might include a little bit blood tinged also at the same point as well. And lot of excessive tiredness, right? Because they're trying to breathing harder. So these are the common symptoms. Not all of them may be there. Some of them may be there, but majority of them you will see in the CAD patient, right? Now, once you see these symptoms, you know the patient has a CAD, what diagnostic test you will do, right? Definitely, you will do something. Now, which test you can do right away? You can do the ECG because you want to check if your patient going into dysrhythmia at the same time, right? How the heart functioning right now. I need to look into ECG at the same point, right? So along with that, you can do actually cardiac catheterization. Now, what is cardiac catheterization? Cardiac catheterization is basically a procedure where you're going to put the stent from the femoral artery, and it goes actually in the coronary artery where you think blockage could be there, that can be open up, right? So we only use the cardiac catheterization when we find some severe case for that and we want to make one of the artery to be get opened up, or maybe the doctor want to see inside the heart, right? What's going on in there? Let's do the cardiac catheterization procedure. I want to read this procedure more in detail for you. Why? Because this is an important procedure. So before we read anything more into coronary artery disease, we need to understand cardiac catheterization at the same time because it's an important procedure. So everybody needs to know. So, being as a nurse, there are some pre-operative nursing interventions and there are the post-operative nursing interventions. But before you read the pre-operative or the post-operative nursing interventions, right? This is actually given very nicely, just so you know, also in your Sounders book as well. If you have a book with you, maybe if someone has a ninth edition right now, you pull up the cardiovascular system, right? And if you find the page number ninth edition or maybe fourth, I think some of the Asian students have a fourth edition also. So put it like in a chat box, what page number is the cardiac catheterization? I can tell you this is actually in, you will find when the chapter started, like after 3-4 pages, you will find like a photo, right? A photo of a person, and that photo tells you the cardiac catheterization procedure is there. Okay. Just a little bit quick reminder, somebody still again on my screen right now trying to drawing into, I think it's Ritu. Please try to avoid using my whiteboard right now because I'm teaching something right now on the board. Because when I'm teaching something, everyone, if something comes on the way, I'll forget what I say earlier, right? So try your best to not to use my whiteboard, please. Again, a quick reminder for everyone. Now, back to cardiac catheterization. What is cardiac catheterization? Why are you doing this for this CAD patient, right? As I said, it's an invasive procedure actually, right? Which invasive procedure? Because we do insert the catheter here into the heart and the surrounding vessels because you want to look into and you want to open the blockage also if it's required, right? Now, pre-operative nursing interventions are very important, which is actually given on your screen right now as well. So I'm just going to quickly read up from here too, right? It says Being as a nurse, you need to make sure the informed consent has been obtained, right? Now, what is informed consent? Those who already watch my lecture in the fundamentals, so you know that informed consent is nothing. It's just a simple, basically, procedure. You need to make sure the client, the patient has all the information before they sign on the paperwork that yes, they're going for this procedure right now. So after they're being informed of risk, the benefit of the procedure, what could be the complications, side effects, so and so, that everything, who is going to explain? Not the nurse. Remember that. Who is going to explain that? The surgeon, the doctor, whoever the person going to perform this procedure, that person's supposed to get the informed consent. But being as an RNs, you need to make sure you witness the signatures as well, and you make sure the patient understand the all condition before they sign on the informed consent. And then after that, in cardiac catheterization, also assess for the allergies to seafood, iodine, radiopaque dyes as well. Why? Because we are also inserting the dye here as well from that femoral artery. When you're doing this procedure, you're also doing the dye insertion at the same time. Now, when you do the dye insertion, basically it's more easy to visualize what is inside the heart, right? Where's the blockage, where we need to open it. Now, if your patient has allergy before to any of these things, you need to make sure you tell physician about it, get the order for antihistamines or corticosteroids, and you need to pre-medicate this patient with that thing as well. So it's avoiding reaction, right? And also before procedure, teach your patient also or the client to hold the solid food for 6 to 8 hours, right? Or maybe the liquids for some time. Usually books recommend 4 hours holding liquid is required before the procedure because you don't want the patient to vomit or aspirate during the procedure, right? Apart from this, document the client weight and height also before procedure, because you also want to compare after procedure as well, right? Because you are actually putting the dye inside, and for the dye you really need the weight for sure and the height, so you can measure how much amount supposed to be give for the dye, because every person weight height is different, and based upon that they will decide how much dye is supposed to be given, right? Now, apart from that, baseline vital signs, you need to get it for sure. And baseline pulse check, you need to do as well. So you can compare post procedure also, right? And then after that, what you need to do is you need to inform the client that local anesthesia also will be administered before the catheter insertion. Usually this instructions given by the person who is taking the informed consent, but as a nurses, you need to make sure the patient still has this information before they sign the document. Now, inform the client that he or she may feel fluttery feeling, right? Or something feeling, when it's going inside, like a dye is going inside into there. So they might gonna feel some like flushed, warm skin at the same time. Or maybe they feel like to cough out, or maybe they feel some palpitations at the same time, some irritation close to their heart. So this is instruction we need to give it before the procedure to the patient. So the patient aware about this thing as well, that this is the expected, right? And then insertion site, the nurses need to prepare this one by shaving and cleaning with the antiseptic solution, which is available in your site. And you need to administer pre-procedure medications also, like sedatives, if prescribed, right? Not all the cases usually prescribed, but if it's prescribed. Now, you need to make sure the IV lines are always in there, because obviously you might need to give some medications at the same time during procedure and after procedure as well. So you need to make sure it's always accessible and available in there. Now, this is a very important instruction. Like, remember, if you have especially a diabetic patient and that patient is taking a metformin and that patient going for this procedure, you need to make sure you withheld this for at least 24 hours before the procedure, right? Why do you do that? Because if you don't hold it, your patient can go into the lactic acidosis, right? Because it's reduced the blood sugar. And then this patient, the cardiac catheterization also this patient getting a dye, right? So because of that, the patient can go into acidosis. So you need to make sure you hold this medication ahead of time. And until what time you're going to hold it? At least for 48 hours, usually the doctor says, or maybe look at the doctor's order based upon the site where you work. We usually make sure that kidneys become clear first, and then the doctor usually start this medication after, right? So this is something you really need to know before the procedure. What are you going to do? Why we are discussing at the same time cardiac catheterization when we do CAD? As I said, always study 360-degree, link everything together with each other. So you don't remember, so you don't forget the things, for a long time, right? I hope everyone is clear so far. Now, post-operative nursing interventions are more related to your bleeding related stuff, right? You can also refer the book later on as well if you like it, but I can skim and scan quickly for you. Usually in the post-operative, you check vital signs, cardiac rhythms, because you want to check for dysrhythmia after procedure as well. Check if the patient is okay, have no chest pain or anything like that. Pulses are okay. So you check the pulse and compare it what was previously, right? And also make sure you check the insertion site every at least 2 hours, right? Minimum, you need to check. You check for bleeding actually there, right? And also make sure if your patient is complaining of any signs like numbness, tingling, patient getting cool and clammy, that's something really emergency. So you know to do something right away and call the physician right away for help, right? Now, apart from that, they said you need to check signs for bleeding, hematoma, and keep the extremity, the one which we use, elevated at least for 6 hours, right? And yeah, this is usually required, and bed rest, minimum for 6 to 12 hours after the procedure, right? So again, you can refer the book later on as well. And if you do not understand anything again into the book, let me know so I can always help you back in there, okay? Now, back to again CAD patient, because we were doing cardiac catheterization to this person if it's required. The next one you're supposed to do is blood lipid levels, right? That's also required to be checked at the same time as well, because you want to make sure the cholesterol levels, how is it for this patient, right? So also check the lipid levels at the same time. Now, what other nursing interventions we are going to do? Because we already read about the cardiac catheterization. Can we do something else as a nurse with a CAD patient? Yes, you can do it. So these are the common nursing interventions, as you can see on my screen right now. I already put the rationale on the right side of the screen, so you can refer it later on if you like it. Again, reminding someone, please not to play again on my screen. Otherwise, I really wish I know how to stop this thing for all of you, because I don't know how to stop this drawing by other students right now. So please, serious candidates, if someone is really want to pass this test, not to play with my screen right now, okay? Because when I'm teaching something, I don't want to miss any points in between. So we really want to make sure. Now, let's see if there is any question, any doubt until in here. How much medicine covered so far? We just start the medical surgical today, and we already covered nursing fundamental, maternity, and mental health so far. There is a question here by the Arsh, why there is a lactic acidosis. So Arsh, as I discussed earlier, the patient is getting dye, right? And dye is not going to be released from the kidneys right away, right? And metformin is also reducing the blood sugar at the same time. So these things can put the patient for the acidosis chances pretty easily. So that's why you want to hold the metformin for this patient. I hope this is clear for you, Arsh, and for the other students who have still the same doubt and a question as well. Let me know if there's still doubt is in there. Now, moving on back to the nursing interventions. So the nursing intervention, what are we going to do, right? So make sure you put this patient on cardiac monitoring. Very important, because you want to check for dysrhythmia, right? And also adequate oxygen available always at the bedside. You give it when it's required. So make sure you do the semi-follows position first, and then you give the oxygen to this client if it's required. So these are the common nursing intervention, which you can do it Because oxygen, I think everybody knows that it improves the oxygen towards your heart and definitely reduce the workload and improve further the cardiac output as well. Excuse me. Now, apart from this, you also need to administer the prescribed medications to this patient. Now, which are the prescribed medication for right now? I would just tell everyone, just remember the names only. I'm not going to go into med details right now, what this med does inside the body, because medication classes are coming very soon within next 2 days. And every time we have to pull single medication at that time. So right now, just remember the names only, but we will discuss later on in the next 2 days, okay? And then it also says encourage the rest and balance activity, right? Why do we need to encourage the rest and balance activity? As I said, it just like basically improve the oxygen demand of the heart, right? And you also make sure the client doesn't stay in pain. So you do something for the pain as well, because the pain definitely aggravate the further symptoms. And once the patient gets stable, see what was the risk factor behind. Why did the patient have that problem? Is it something related? Patient has a, sedentary lifestyle like smoking, diet, obesity, or maybe existing medical condition, diabetes or something that they're not working on it. So something you think you can work for the patient. So just do that. And once the client gets stable. Apart from that, once the client gets stable, you can teach them, you can teach their family members also about the lifestyle changes, medication, what they can take at home, and what symptoms they need to report to the hospital or the clinic number which you're going to give it to them. Something in emergency, if it happen in the house, what they're supposed to do, right? Apart from this, you also teach your patient about the complication if possible before they go home, right? So for example, you teach them about, okay, myocardial infarction can happen, arrhythmia problems can happen, even the heart can be failure can be happen if we don't take the treatment on the time, right? So importance of taking treatment, sedentary lifestyle is very important. This is something you're going to focus for them. And also sometimes this is very life-changing situation for some patients. So emotional support might be required by family members too. So make sure you do provide emotional support wherever it required, because that helps the client and the family member reducing the anxiety a little bit, right? And apart from that, you can collaborate with your another team members too on the floor if it's required, right? So for example, maybe my client is going home and the client requesting for the oxygen, right? Supplemental oxygen to take at home, right? If I don't know where to get that oxygen so they can use at home as well in case they need it, so definitely I'll let them to collaborate with my other team members on the floor. Probably I'll go for the social worker. So who can actually see if they can arrange some finances, like financial thing for them, and they can make some arrangement for the oxygen. And sometimes the social worker has all those resources from the community, and they can definitely like let them to be arranged, with them as well. Now, I got a request on the screen right now. Somebody wants to record this video. So just so you know, videos will be recorded and it will be shared right after the class on the YouTube. You can always listen back again for again and again. There will be no lock. Okay. My classes are never locked in there. So you can listen them as many as time, as much as you want. And after watching these videos again, if you find some doubt again, type in the YouTube comment. I'll respond back to you as well. Okay. Or you can also contact me on the WhatsApp so I can clarify your doubts back again. Now, this is about the CAD medical condition in detail. I hope it's easy. It's not too difficult, but let me know in the comment section, please, in the YouTube or Zoom, wherever you're joining this class right now. If it's clear, if it's not clear, maybe just type clear, not clear. If a doubt, maybe type the doubt for me before I go quickly to the myocardial infarction. Let's see if it's clear for everyone or not. Clear? Is it easy? Not easy? Still crazy, right? Because I know a lot of people don't like the cardiovascular system, right? So I want to make sure you still find it easy. Hopefully, by the end of the session today, we'll try our best, okay? So thanks for responding back into there. Now let's move on quickly to the next part, which is the myocardial infarction, right? Now, as I said, this is something can happen if you don't look the angina or CAD patient, right? So what is simple meaning, simple language of the myocardial infarction? As I said, ischemia of the tissue, myocardial tissue. Why does it happen? Because of lack of supply of oxygen in there, severely deprived of oxygen. The heart is the muscle of the heart is not getting oxygen, so that can become ischemic, necrosed, and that condition we call is the myocardial infarction. Common language, heart attack patient, right? Now, who will be at the risk for heart attack or myocardial infarction? Who someone already have a history of arteriosclerosis or maybe coronary artery disease before, or maybe high cholesterol levels before, maybe smoking since very long, high blood pressure problem before, like obese patient, maybe sedentary lifestyle overall, you can say a lot of stress, not moving at all, not walking enough, right? So all factors may be possible, or maybe some of them factors in there, and that can create in someone the heart attack problem. So heart attack does not happen right away. It usually give you, a warning sign before. Which one? Angina, right? Like a little chest pain can happen at some point before, and then it goes to the myocardial infarction, right? So now, when you see this patient, what are you going to check, right? Same sign and symptoms almost. So you don't have to really cram everywhere, right? Chest pain, nausea, vomiting, doesn't feel like to eat or drink something, stomach is upset, right? Maybe sweating is there a little bit, diaphoresis, right? Why? Because the circulation is changing now, right? Cool and clammy skin may be there, right? And patient can become pale first and then later on can become blue little bit, cyanosis, right? Not able to breathing enough, because everyone knows heart is connecting with the lungs too, right? Dysrhythmia problem can be started. Why? Because your heart is pumping faster, right? Not getting oxygen, right? And then for this patient, which blood work do we do? What do we check in here? How do we check the patient for the myocardial infarction? Most important, remember troponin levels. You do check CKMB myoglobin also, but troponin level is the main indicator, right? So if someone has a myocardial infarction, this is what you're going to check. Now, again, if you want to refer your Saunders book, right? In your Saunders book, there is a section given on the second page of this chapter, diagnostic test, right? And in the beginning of the diagnostic test, they tell you actually detail about the cardiac markers. Let's read a little bit on that too, right? It's important sometimes, so everybody needs to know, right? So I'm going to skim and scan a little bit quickly for you. So if you're writing exam, just so you know, for the NCLEX, just so you know, you do not need to remember the normal values, because they will also give you normal values in the exam as well. So you just look if it's high or if it's low in there, right? As of today, when I'm making this video, this is the as per the current NCLEX right now. But if someone is watching this video after some time, maybe the rules can be changed at that time. But if someone is for the NORCET or any other examination, yes, you need to know the normal values too. Okay. Now, CKMB is basically the first one they give it to you. They said the elevation in the value of CKMB, so high CKMB, that can indicate the myocardial damage, right? And it usually go high in first 18 hours. First 18 hours after the ischemic attack, right? So this is something they tell you in there. Now, after that, they tell you troponin level, and they tell you like troponin is basically, they divided for you troponin C, I, and T. Remember, troponin I is the main one, which you need to check. So troponin I always rise within 3 hours, within 3 hours of the ischemic attack, right? How you can remember if it's 3 hours? Maybe let's give you a simple way. Maybe just remember that Caps usually give the notice in the WhatsApp group that I'm joining within next 3 hours or 2 hours, right, for the class. So this is how you can correlate in the exam at that time, and you can remember, yeah, it's roughly within 3 hours somewhere the troponin I is going to be high. right? So it's easy way if you want to link with me with my classes, right? Now, after that, you also want to check the myoglobin as well in this patient. So myoglobin also rise within 2 hours as well, and but it's declined rapidly. That's why it's not the best indicator as well, right? Now, apart from that, what do we check in here? We also check the ECG for sure, because you want to check the patient again for what? Dysrhythmia and how the heart is functioning at that time. What does the pulse look like in there, right? So put the patient on the cardiac monitoring and also do the ECG at the same point. But the main in myocardial infarction, do not forget everyone, troponin I, which is going to be high within 3 hours of the ischemic, right? Now, once you know in the myocardial infarction is this one, right? You need to do something as a nurse, as an RN, right? If someone is watching this video as an LPN for the LPN's examination, you can think about as an LPN, as a nurse in this situation. So what are you going to do, right? So the first one I can see here, the nursing intervention is obtain a description of the chest discomfort. This is only I will do it, once the patient gets stable, right? Then only I will ask the questions like that, like how is your chest pain look like right now? Is it like still you have a chest pain? Is it radiating right now? Do you know when does it started? How does it feel at that time? Because most of the time when the patient is in acute phase, they're not able to tell you, right? And definitely you also want to do something right away at that time. Apart from this, oxygen and pain relief measures. Morphine nitro is usually the best. We usually do the nitro first, everyone, right? That is recommended in the chest pain, but you can only give up to the 3 nitros. You will see this information with me in the cardiac medication lectures also. So basically, it does vasodilation a lot and it does reduce the blood pressure a lot. You really want to make sure you check the blood pressure too. Um, Now, apart from this, you only give the morphine if the nitroglycerin is the not effective. Then you only do the morphine. But for morphine, the patient breaths needs to be less than 12 breaths per minute. Not less than 12 breaths per minute. If it's less than 12 breaths per minute, you cannot administer morphine as well because morphine does the respiratory depression, right? So these are the common things which you need to know for sure. Just give me 5 minutes, everyone. I'll be right back into the class back again. Until that period of time, if you want to read my other nursing interventions, feel free to read it, and I'll be back in here quickly. Thank you. Okay, I'm back, everyone. Not even 5 minutes break, I guess. Okay, let's get started back again. I hope you read the rest of the nursing intervention a little bit. Um, so here, um, apart from doing oxygen and pain relief measures, you also want to make sure you do keep checking vital signs during your shift, have the patient on cardiac monitoring, and I think this is we done earlier too. But apart from that, you also check their lungs, right? Why do you need to check their lungs? Because if you see any crackles, any wheezing, any fluid accumulating kind of sign, that indicates maybe now patient might get going into the heart failure, right? We don't want the fluid into the lungs, but this is something really bad. So that's something is very, very important for you to look into. Apart from this, make sure the bed rest is also provided to this patient and semi-follows position is recommended for this patient. For NORCET exam students, I really want to highlight it. Your positionings are very important in the exam. So make sure you do focus more on positionings also, especially for prelims. And for the NCLEX students, the positioning is also very important, especially in select all the reply type of questions. So some positionings are very commonly tested in the exam, which I already posted into the nursing fundamental. If you cannot find that slide into there, you let me know later on so I can send you that screenshot in the WhatsApp group later on as well. So those are the common positionings, which everybody needs to know, right? Now, apart from this, what else you can do with this patient is you need to make the IV access route always accessible and make sure you keep getting the ECGs on the time, right? 12-lead ECG. Lab values, the one we just talked about in the previous slide, especially which one? Troponin I. You need to make sure. You still have to do the CKMB myoglobin as well, but you still have to do the troponin I. That is the main indicator, as I said. Now, apart from this, you make sure your patient is not going into dysrhythmia. Okay. Now, some students, if you do not know what is the meaning of dysrhythmia means abnormal heart rate. It can either low, either very high, right? But usually it's always very high because we only have one low, bradycardia, right? So here the patient usually go into higher sides, which is like tachycardia. And a very, very in a bad stage, this patient can go into PVC. PVC means premature ventricular contraction. Okay. For right now, I can tell you the simple meaning of PVC is when the heart is actually skipped heartbeat, for some time. So that skipped heartbeat in a simple language, we call skipped heartbeat, but in medical language, we call PVC, premature ventricular contraction, right? So definitely it's a bad if it's happening frequently again and again, that is something really bad. But PVC, I will discuss more in detail when we will do ECG lecture because it's coming in as a part of the ECG in there. For right now, maybe just write down PVC is equal to skipped heartbeat. So at least you know the meaning, right? Now, this is something you always check in the first few hours after the patient has the MI. And make sure you do some meds. Which meds? Antidysrhythmic meds. Now, what are the examples of antidysrhythmic meds? Again, right now, everyone, just hold on. We are coming with the meds very, very soon in the next lectures. Right now, just remember names, which medication giving in what condition. But at that time, when we discuss each medication in detail, that time you will understand more in which condition you can give which one with me. Okay. So for right now, just understand the name and then we will link together. Okay. So right now, I'm not going to read this one in detail, thrombolytic, antidysrhythmic, because this is, we have to come back here again for sure. So beta blocker, you can also give it as well. And what else? You also check the pulse and skin temperature, right? Because if it's bad, you cannot find it, or skin may be cool, or sometimes it's like really pale temperature you check, it's really cool, and the skin look pale and cyanotic. That indicates the cardiac output is really, really bad. Now, apart from this, you also do, let's see here, if there is any other medication name here, I need to highlight it. Okay, not right now, but they said you need to check the blood pressure very closely for this client, especially after the administration of any medications, because it can low down when we give these meds for high heart rate. The heart rate can go down as well, and the blood pressure lower will be possibility with these medications. But again, these meds we will discuss in detail. So hold on for now. Okay. So right now, if you find this slide a little bit difficult, maybe come back to this later on with me. Okay. And the last thing they say, provide reassurance to client and family, because it's definitely a difficult and hard situation for both of them once the client get recovered. But it can, happen back again as well, or patient can go further into heart failure. So definitely you need to provide the reassurance at some point to them. It's something financial cost could be also related to maybe too much expensive in some hospitals as a part of treatment maybe. So that is all about the MI in a simple language. What is MI today, right? Again, any doubts in between, you can always use the chat box for me. And I'm moving on to the congestive heart failure quickly before we go to the next topic after that. So the congestive heart failure, let's see what it is, right? Congestive heart failure, it's basically what we have. If you see this picture, maybe first of all, it's easy to understand from here. This is how the normally heart imagination, like how the normal heart photo look like, right? And this is the congestive heart failure. See a lot of congestion, a lot of traffic here, right? Backup, like of a lot of blood, right? So what is happening in there? So to understand them, we have to understand something else first in a simple language. So first of all, remember, heart failure does not happen right away in someone. It takes time. As I said, patient will have an MI before, and before MI angina or CAD, and then patient after an MI, the patient go into the heart failure, right? So it's a chronic condition. It's not something happen right away, first of all, okay? But what is the simple meaning, as I said? When your heart is not pumping blood enough the way it should be, it's like a weak and tired now, right? Now, usually heart failure happens, right, when the heart cannot pump either the blood systolically or maybe diastolically, right? Or maybe both also, right? Now, systolically, diastolically, let's simplify a little bit for you guys, just a little bit basics, right? Systolically, contraction phase, when the heart is contracting, right? Heart is squeezing basically in a simple language. So the blood is pumping out, the blood is pumping out of the heart at that time because it's squeezing at that time in systolic stage. Now, in systolic, we have basically atrial systole and the ventricular systole, right? In atrial systole, basically what happened is the blood push into the ventricles in atrial systole, right? And in the ventricle systole, from the ventricles, the blood either go to the body or either go to the lungs, right? If you remember everyone, little bit the normal, the cycle, the cardiac cycle, right? So what is usually happen is like this is like your right side, right? This is your right side of the heart. This is your left side of the heart. I can see Divyanshu, you are using my board right now. Please stop using it, Divyanshu. I can see you're using my board right now. Don't click anywhere, please. Okay. So right side and the left side of the heart. So if everybody remember that, right? So this is your right atrium. This is your right atrium, right ventricle, left atrium, left ventricle. Your blood comes here from the body, from superior vena cava, inferior vena cava. They brings the blood here and it goes to the ventricle, right? And from the ventricle, it will go towards to the lungs, right? From the pulmonary artery, it will go towards the lungs to get purified first because it's a deoxygenated blood first, right? And after it gets purified from the lungs, so maybe imagine I make a lungs here for you, right? After it gets purified, then it come back through these veins, right? And it goes into the left atrium, and then from left atrium to left ventricle, and then from left ventricle to where it's going now, from the aorta to the rest of the body. Now this is a purified blood towards rest of the body, right? Why did I recall this cycle for a lot of students? Because some students are writing here, I know the different type of examinations too. So you need to know some basics, systolic phase, diastolic phase for your exam. Again, three students, Jaskirat and Mushtaq, you're using my screen right now. Please avoid using the screen right now, please, because I can see your name in there. Now, back to systole. Systole has two phases, as I said, atrial systole and ventricular systole, right? Atrial systole means the blood push into the, like in the atrial, like when the atria contract, it's basically push into the ventricles in the atrial systole. When the atrial contract, it push the blood into there. But when the ventricular systole happen, you will see the blood push either to the lungs or either to the rest of the body in systolic phase. And remember everyone, in systolic phase, you will see the lub sound, S1, lub sound in systolic phase, okay? You will hear that in there. And then you have the diastolic phase, okay? Diastolic phase is basically, it's like a relaxation phase now. It's not like contracting right now, the way it was systolic phase. Now your heart is relaxation, in relaxing mood and filling up the blood inside, right? This is your diastolic phase in simple language. Basically, these chambers are filling up right now, normally. Normally, what I'm talking about, not in CHF right now, I'm talking about yet. Right now, we are learning the normal things behind it, right? To understand the CHF. Now, here, again, blood filling is happening. Those students who are writing different exam, not the NCLEX, you need to know isovolumetric relaxation and the ventricular filling. Those are the two types, the two stages you can say happen in the diastolic one. You can always repeat this video back again if you miss the word. Again, this is something I'm repeating, diastolic and systolic, for those students who are not writing the NCLEX, because NCLEX is not asking you what is systole and what is diastole. But the other students who are joining this lecture, you need to know for your competitive exam, lub, dub sounds and systolic and diastolic as well, right? So remember, in the isovolumetric relaxation, which is the stage of the diastolic one, here the heart basically relax, right? But no filling started yet, right? But the second one we have, which is the ventricular filling. In the ventricular filling, the atria and ventricles, they both fill with the blood, right? Now, again, if you find this difficult, either you can ask me the handwritten notes for systolic, diastolic, I can share with you for the other competitive exams. In your WhatsApp, I can share later on. Just send me the message there, or repeat this video back again, because it's going to be recorded available on the YouTube, right? But this is a little bit basics if somebody needs to know. And in the diastolic one, the dub sound, right? S2 sound will be going to be produces in here. S1 sound usually produced when the AV valves is going to be closed, like mitral and tricuspid. And the dub sound, which is S2, it usually happen when the semilunar valves is going to be closed, which is your aortic and the pulmonic, right? Now, this is a basics here, right? Now, but what is a CHF? CHF is nothing. CHF is basically going to happen is when either systolic or either diastolic phase is not pumping blood enough properly. So basically these phases are getting bad right now, or maybe both of them. So maybe their contraction is also not good, right? Or maybe relaxation mode is not good to fill the blood, or maybe both of them, that it's just the traffic is going to be started. So you will see a lot of congestion is in here of this pulling blood. It's coming back, back, back. So if this blood, let's say, imagine if this is a ventricle, left ventricle right now, if the blood come back here from the pulmonary artery, right, then definitely this blood will go back towards the right ventricle and then now go towards the rest of the body from where it comes back, right? Similarly happen in the left side of the ventricles also, right? So here, if the blood, let's say, come back, let's say from the aorta, it just go back, push into the ventricles here, right? Now this blood can go back to the atrium. and this blood can go back towards the lungs. So lungs related symptom will be started, which you will see in the next screen with me, right? So CHF is nothing. It's just a lot of congestion of fluid in there, right? Because it's not pumping the blood enough right now, the way it should be. But you really need to know what sign and symptom you will see in the left-sided heart failure and the right-sided heart failure. Very, very, very favorite question, which everybody needs to know. Doesn't matter which nursing writing exam you're writing down, you must need to know this one. Okay. So first of all, maybe we will do the, let's say, right-sided, right? Then we'll go to the left-sided, right? So to understand these symptoms, again, I'm just going to make imagination drawing of the heart right now. This is not the actual heart, it's just the drawing heart, right? So dividing again back into the right side, right? Again into the left side, right? So when the heart right-sided heart failure happen, as I said, this blood will go back like it come back from pulmonary artery, it come back in the ventricles. Now from ventricle, it go back into atrium, and now it go back towards the rest of the body, right? From where it comes earlier. Now, when it go back to the body, you will see all these symptoms are related back to the body, right? Congestion back happening in the body. So you will see a lot of edema, especially in the legs and sacrum. The patient will be having a lot of edema. And from superior vena cava, this blood is going back actually towards towards the brain. So you will see jugular vein distension on the way in here. So this is something sign you want to check. And it's also going to the rest of the body from inferior vena cava. So you will see some other organs are also big in size, like abdominal distension is there, hepatomegaly is there, megaly, big size. So splenomegaly, doesn't feel like to eat or drink anything, anorexia, nausea, weight gain overall, right? And then nighttime, you will see nocturnal diuresis is pretty much common in these clients as well because of lot of fluid accumulating in there in towards the kidneys as well. And swelling of the finger hands, as I said, edema is pretty much common everywhere. Blood pressure, I'll talk about in few minutes. So hold on to this point right now because it's similar in both cases. We're going to talk about it. So these two, wait for me. Okay. Now, moving on back to the left-sided heart failure. Left-sided heart failure, if the left side is not functioning good enough, right? So as I said, this blood from aorta going back now in the ventricle, from ventricle going back into atrium, from atrium going back to the lungs now. So you will see mostly lung symptom here, right? Like pulmonary congestion, patient not breathing enough because of lot of fluids is in there, tachypnea, crackle sounds, sometimes dry hacking cough may be present as well. And even in the nighttime, you will see, this patient is standing up again and again in the nighttime and telling you, I'm not breathing enough. So this is we call paroxysmal nocturnal dyspnea. In the nighttime when standing up and suddenly not breathing enough. So patient has to sit for some time in the standing position, right? So this is we call PND, right? Now the last one I want to talk about the blood pressure related. So in both cases, the blood pressure can be higher or it can be lower. It depends, right? Because if it's initial stage and the fluid just accumulating, right? It's like a fluid volume excess, right? In that case, you will see high blood pressure in both cases, right? Or the blood pressure can also go down as well when especially it's a late stage of the heart failure, when the heart is really not pumping the blood enough at all, not much cardiac output is in there, the blood pressure can drop down as well, right? So it depends upon the condition and what stage of the heart failure the client is. So it depends upon that. At that time, you will see the blood pressure. So I hope it's clear until here. It's nothing really complicated, guys, but you can always stop me in between so I can help you in there. Moving pretty quickly to the nursing intervention or what are you going to teach this patient? I highly recommend everyone, you can take this presentation slide from me because sometimes in the books, it's too much information in there in the cardiac chapter. And I know some students, they have difficulty in reading that. So these slides, I try my best to make it a little bit easy notes for you. So you can always refer to these notes if in case you like it. So you can access to this presentation as well. Now, moving to the nursing intervention quickly, especially when someone in the acute phase right now, what do you do right away? You do the high follows position in that case, so the patient can breathe. You give the oxygen as the patient required. You do the quick rapid assessment, check the lungs faster. You want to check for fluid quickly in there, right? And make sure you do the diuretics and morphine as well. The client should be in pain, and you want to do the diuretics because you want to take the fluid out, right? Which diuretic we give in here, if someone knows, you can type in the comment section, but I'll tell you when I do the medication section as well. I'll tell you more in detail about the different type of diuretics in there and which diuretic you're supposed to give in here at that time. But if someone know, you can always participate and use your knowledge, right? Let me see here. Uh, if someone put in the comment section something for me so far. Okay. Okay, Praveen question is, ma'am, can you tell me what are the changes seen in the ECG? You will see the high tachycardia, like more than tachycardia. So this patient has a dysrhythmia, right? So very, very high tachycardia. So probably the patient is going into the atrial fibrillation, I would say. Moving on next to the question is send this presentation WhatsApp group. Yeah, I'll do that for sure. Maybe I'll put it in the YouTube as well under the video so everybody can access it freely. But I'll also do in the WhatsApp group as well because some students I know they're not with me WhatsApp group, so everybody can access it. And there's a question on the YouTube. They said, ma'am, is there any diagnostic test that can predict the MI or heart attack? Yes, my dear, that will be a troponin I. That's something you want to check. It will be elevated in the MI patient within 3 hours. So those are the only questions I can see so far on my screen, but you can always ask me the doubts, any questions if you have, okay? Now moving back again, you got an acute patient in front of you, CHF patient, heart is not pumping enough. What else you do? You can do intubate, you can do ventilator support if it's required, right? And definitely this might patient require the Foley catheter also at the same time. So you follow the procedure, and documentations are always important for everything in there, but don't do documentation right away once the patient gets stable, right? And always look the output as well. And the dietary considerations, whatever you think the patient is taking, but in the acute phase, patient is not taking right now anything in there. So definitely, I'm not going to give anything at the moment to this patient. Patient is in acute phase. Once the patient gets stable, right, what are you going to teach someone? And this could be a good things for you to look for your SATA question most of the time as a part of notes, especially for the NCLEX students and NORCET for the mains exam. When you have SATA question, this could be a good study guide for you guys. Now, positioning once the patient gets stable, right? Make sure you encourage the balance between activity and the rest. So this is something you're going to teach to the patient. Not activity all the time, not rest all the time. Like make a balance between them. Avoid isometric exercises, those exercises which you think that increase the cardiac workload too much. For example, if I'm running on a treadmill right now, right? Definitely it will increase the workload of my heart, right? Or let's say I'm doing heavy lifting right now. That is something big no to, right? So those are the common examples, or maybe using upstairs, stairs going up really faster. No. Now, teach the daily weight monitoring as well to the patient. This is very, very, very important in CHF, I would say. So especially if there's a sudden weight gain, this is really, really bad. And they need to report it actually if this is something happen, because that also tells us the client condition is getting worse, or is it getting better? Is it still the same? But when you teach them how to do the weight monitoring, make sure you teach the patient same machine, same time, same clothing. Same machine, same time, same clothing, if possible, to get the accurate weight. This is what they're supposed to do. Now, apart from this, when the patient going home, you look at some meds, you explain about those meds as well, how they can take those meds, when they should stop it, when they should consult the doctor, right? Always tell them never stop by themselves. Even if they feel better, they need to consult the doctor first. Now, these meds I'll also give you in the next slide. If you want to look at maybe that slide, maybe that's easy for you. And as I said, I'm not going to pull the medication detail today because we are doing in the next lectures. Apart from this, you also teach your patient about side effects, adverse effects before they go home. They need to know about all those meds too. And fluid restriction, remember guys, only click the answer in your exam about the fluid restriction if it's prescribed. This is a very much trap actually. A lot of students, I know they know that the CHF patient, we don't give too much fluid, right? But being as a nurses, this is not in our authority, okay? You only click on that as a right answer if it's prescribed either in your question or either in the answer key. It says it's prescribed. Then only you click on it. Otherwise, you don't click on it, okay? This is my advice for all the students. Now, apart from this, you also educate the patient about the lifestyle changes, what leads to them this problem in their life, the CHF, how come they reach there. You try to figure out those conditions with them, the risk factors, so they can work on it and they can improve it as well, right? So this is about some common interventions or what you can teach. Now, lastly, before we wrap up this topic, this is a very nice slide, actually. I like it because it's easy to remember and it's colorful. This is for the medication. In case you are the candidate who likes something more visual to learn, and you want to learn the medicine this way, A, B, C, D, 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 maybe it's easy for you this way. So you can take a screenshot of this medication, these medications you want to give to someone who has the heart failure. Because the main purpose of the treatment here is we want to make sure we drain the heavy fluids here, right? And there is only two ways how you can do that, either by the medication, either by the lifestyle change, right? So you really need to know these meds so you can teach your client as well. You can always go back to my presentation, take this print out of this slide, or maybe take a screenshot of the video as well so you can have these meds ready with you. Now, that's all about until here today for all the topics. What we're supposed to discuss. Now, before I ask you any question further here today, let's see if there is any doubt, any question until here for me with the topics which we discussed today, or if it's clear, maybe just say clear. Then I'll quickly go over some MCQ question with you before we go today. Any doubts, any question until here, anyone? On YouTube and also on the Zoom. Okay, clear, no doubts. Okay, no doubts. If you say no doubts, is it easy today? Like you find easy cardiac so far or not really, everyone? Because I really needs to know this. This was like something, a really, really requested topic, I remember. Like everybody was like, we want to learn about the cardio. So I really need to make sure it's not something still harder for you. I try my best to make easy as much as I can for all of you. Okay, I can see some clear, clear, clear. Some other students, if you're still listening right now, if you have a doubt, any question, you can always type in there. Okay, perfect. Okay, so now without wasting the time, I can see it's clear for majority of the students as well. I don't have any doubts until in here. Now, this is the first question on my screen, everyone. And to participate, let's see here. You can just type in the chat box, I would say. And if someone has a major, major doubt in these questions, and then I will allow you on the mic to come with me and participate as well. But let's see this one first. Hold on, maybe I'll open the mic for all of you because it's more easy actually. Hold on. Just in case if someone wanna participate on the mic. then they can use the mic as well. And hold on, I'm just going to open the mic right now. Just give me 1 second, guys. I'm trying to finding out a way how to do that. I think I find it. Okay, so I already opened the mic for all of you as a permission. In case someone has, you want to come forward, you want to participate, unmute your mic in this question with me, right? Because remember, guys, this is your opportunity to learn with me, things with me right now, how to find out the answers into the question, right? So this is a very simple, easy question. The first question I have on my screen, but you can also use your chat box as well. The nurse is caring for a client hospitalized with a heart failure. Now, if you see this word, which client finding is most concerning? Maybe everything concerning here, everything. And I know, most of you gonna pick the answer number 2 or 3. I know that. Why? Because lot of students I know what they do is they just follow ABC, right? They just follow ABC, right? So when they see the word like Disney oxygen, they always click on it without even thinking about any second, right? But let me tell you guys, if the NCLEX exam is so easy, every answer can be ABC, everybody will clear the NCLEX, right? So I highly, highly recommend, especially for NCLEX and for NORCET mains, do not be into trap of ABC all the time. Yes, you need to know ABCs for sure. It's good to know, but you still need to know how to apply them, right? Like you always think in that way. So let me see if someone find out this question as a right answer so far in my chat boxes. YouTube students, try your best to participate as well. I can see majority of them, they pick number 2, but some also pick number 1. Very good, right? I would like to have maybe Tessie and or Raki or either Rubina Sohail. Like you pick the answer number 1. Maybe come on the mic if you can, either of you, right? Why you want to pick answer number 1? Why not number 2? Can you explain, everyone? Then I'll explain you my answers. Anyone or maybe any volunteer here who picked the answer number 1? Why answer number 1? Why not number
Madam, I choose option number 1 because I think the frothy pink tingled sputum is the main symptom of pulmonary edema. That's why I choose option number 1.
Very good.
Pulmonary embolism.
Very good. Pulmonary edema is what? Pulmonary edema means accumulation of the fluid in the lungs, right?
Yes,
And that's definitely another medical emergency. We don't want that, right? So this is something really concerned. So let's hold on for now until you compare with the number 2. Number 2 says proximal nocturnal dyspnea. We just read that in the heart failure, this is expected, right? So if this is something expected, is this something a medical emergency for you? Why I'm saying medical emergency? Because the word says most. When the word come most, you want to think that way, something you don't want to miss out. You want to pick that answer right away, quickly, faster, top of the list, right? So out of these 4 options, what's more concerning for you here? Something you think is a medical emergency or very, if it not right now, maybe could be happening there. So, this is how you think in that way. So I'm not going to pick answer number 2 because this is can wait. This is something expected, normal. And they don't tell me right now what CO2 look like. So I'm not going to go into this trap. The last one I have, number 3 here, is the second last. It's 92/67. Again, this person, blood pressure low could be expected as well, but not going to die with this blood pressure right away. This can wait, right? Nobody can die with the edema also as well. That can wait, and that's expected. So only answer. Let's see. If students don't know the answer number is 1, I highly, highly recommend use elimination method. Elimination method is you don't know the right answer, but you know the wrong answers for sure, right? The wrong answers you try to eliminate first. So like 4 and then 3 and then number 2. The leftover answer is the right answer for you, right? So this is the first question. The right answer is 1. I hope everyone understand this question so far, but you can always stop me in between. Now, students was requesting a lot. Ma'am, can you please bring some case studies, some engine styles and NCLEX questions so we can see what type of question they're asking in the NCLEX? In my other videos, I already make some different type of questions already. But in today's question, I bring one engine style question in front of you. Let's see how to do this question together. Okay, so here the question will be on the top of the screen. This is a main question, the one you have to read it. And then this is another question linked to it, but let's see how to solve it together. The nurse discussed the lifestyle changing. The nurse discussed lifestyle changes to manage the blood pressure with a 47-year-old client who has a history of MI, high blood pressure, hypertension, and the high cholesterol. So 3 conditions are there, but these are the history. It's a history, right? So it's like a part of diagnosis now. But the mainly is what? Mainly you're trying to discussing today how to change the lifestyle, how to manage the blood pressure basically, right? So this is your main question. Now for each statement, like for each of these statement made by the client, so your patient say all of these things on the left side of the screen, click to specify whether the statement indicates understanding or no understanding. Like, how do you know by looking at which statement you think patient understand everything about it, or you think patient do not understand anything about it, right? So imagine if I'm your patient here and I'm telling you this thing. So let's try to participate with me, everyone. Come on the mic. Whoever volunteer wants to come, want to learn with me, come on the mic, okay? So freely open class, participate as much as you can, okay? The first one says, I should limit myself to 3 or 4 beers after the work. If I'm telling you this as a patient, like I should limit myself to 3 or 4 beer after the work, do you think it's a good idea or is a bad idea? First of
Bad
all,
idea.
bad idea. Do you think I understand something?
No.
No.
Yeah.
Right? The second one, my smoking helps me whenever I feel irritated or stressed. Do you think smoking is a good idea when I feel stressed?
No, it's
idea.
no understanding.
Bad
Bad
idea.
idea.
No understanding. So in the real paper, guys, just click on these boxes. Okay, so you will get the answer clicked in there. Now, if I tell you, I'll tell my wife to start buying 1% milk instead of whole milk. Good idea or bad idea?
Good idea.
Good idea.
Good idea. There you go, because I'm using a less fat. As you can see, whole milk has a more fat, right? Now, when I eat out, I'll order a baked potato instead of French fries. Good idea, bad idea?
Good idea.
Good
idea.
idea. Very good.
Good idea.
When the weather is nice, I'll go for a walk.
Huh?
30 minutes walk. Good idea, bad idea?
Good idea.
Good idea.
Good
right?
idea.
I'll try to focus on my breathing when I start to feel overwhelmed at work. Do you think it's a good idea or it's a bad idea?
Good.
If I'm focusing on my breathing, let's say right now I'm overwhelmed in the class right now, right? And I'm trying to focusing on breathing at that time when I'm overwhelmed.
idea.
It's a good
Good
idea or is it
idea.
a bad idea?
Good idea.
It's a good idea because it helps me to be relaxed, release anxiety at the same time, right? So this is something good idea. This is not a bad idea. Now, why I'm bringing these style questions in front of you, so you actually know how much to read the content. Because I remember one of the students texted me yesterday. I forgot the name of the person, and I think it's confidential also, so I don't want to say even if I remember the name. That person was like, ma'am, I'm reading too much anatomy physiology in detail for the NCLEX. No, you don't need to know that. If you look at these type of questions, you need to know more strategies, the style, how to answer the question for your paper, rather than reading too much into the content. Those students who actually watch my very first video on the YouTube, you know that I actually talk about in there. You need only 30-40% content for these exams. The rest is all about the strategies, how to answer the questions at the end of the day, right? And you will still make it. Now, everyone got the answer in there. Now, last question before you go, everyone. This is another NGN-style question, right? It's a case study type of thing you can say. And I would call this question as a bow tie question as well, right? Because you need to find out some problem, what is happening in here, and what are you going to do for that as well. So let's see the question first, then I'll tell you how to solve this type of question, okay? The question is, a client arrives at the emergency department with a severe chest pain, and that is radiating to left arm, nausea, and diaphoresis. So something happening further, right? Now the healthcare provider, your doctor, suspect what? Acute MI. Okay, so you got acute MI patient in front of you, something happening right now. The nurse, so you are the nurses here. The nurse review the client laboratory results and the client status. Okay, you check something about that, like what is the client laboratory results and clinical status look like. Now, when you check the laboratory results and the client status, I actually forgot to put in here the laboratory results. So I want to give you that right now. So just give me a second for that. So I'll give you the troponin level. So in the NCLEX, they give you normal level also, and they give you the patient value also, right? So if I give you the normal value is less than 0.3, right? Ng per ml, or you can say mcg per L, right? Whichever units you want to use, right? So this is like a normal value, what everyone's supposed to has it. But this patient has actually 1.8 right now. 1.8 right now. So if I give you that value right now, right, you have an acute MI patient. This is the normal value, 0.3, but your patient has, in this case study, is 1.8 right now. So first of all, ask yourself, is it high or is it low than the normal value, right? So you will be like, it's higher side, right? Now, once you know it's the higher side, right, you see the first question related to this case study. The first question they wants to know, what is the most likely condition happening in here? By looking at this information, what they give it to you. Is it the elevated myoglobin? Is it the acute myocardial injury? Is it the stable angina? Or is it the heart failure exacerbation as well? So this is something you want to look into, right? They will also give you more lab values, which I forget to put it in here, as I said. But if you want, I can tell you another lab value, which is the myoglobin value, right? The myoglobin value, make it easy job for you. This is usually rises within 2 hours, as I recall theory before, like usually rises within 2 hours, but it rapidly decline after, right? So the lab values, they actually only write it down. The value is rises. So when you click on the box, they give it to you. The value has been rises, right? So what do you think the option number 1, everyone? Which one you want to select in here? What do you think? What is the most likely condition happening in here? Should I say elevated myoglobin? Should I say acute myocardial injury? Should I say stable angina? Or should I say heart failure exacerbation? What do you guys think? Just feel free to come
Myocardial
forward.
injury.
Myocardial injury.
Injury.
Okay. Anybody else too? Myocardial injury or any other? Maybe make a guess. Use the elimination process. So see this one, stable angina, right? So maybe start eliminating one by one, right? See exacerbation of the heart failure, right? So this is how you look into, right? And I can see Rubina also picking number 1. Okay, 1 is for which one? Because I just saw your message. So I don't know if it's for this question or previous question. Okay, I can see Raki right now answering in here in the chat box, and even the YouTube students as well. Raki says the answer is also myocardial one. Okay. And let's see the other one too. Okay. Any other? Okay. So I'll pick the answer here in the first one is the acute myocardial injury. Even the elevated myoglobin will be there, but as I said, this is not the best indicator to see what the condition happening, because myoglobin will go rapidly decline at some point. So you cannot just look at the myoglobin and see and say, oh, this is definitely what's happening in there, right? So acute myocardial injury is more closer what's happening in the acute myocardial infarction. This patient is not in stable angina for sure, not even exacerbating further right now. So those two options you can eliminate it very, very first. Now, second question which I have related to this, what two nursing actions you will take here? Only two, right? Now, remember when they said two, you cannot pick one, you cannot pick three. You must have to pick up two, right? So out of A, B, C, D, 3, which two answers you think it's a very, very high priority? You want to pick those answers too for sure. What do you guys think?
A and B.
A and B. Okay. Anybody else?
Ma'am, A and C.
Very
A and
good.
C.
Very good. Now, those who said A and C, can you tell me why not B? Why C? Any idea?
Because
Whatever
they
makes you
need a
think.
semi-forward position, not a high-forward position.
There you go.
Yes,
Very
ma'am.
good.
Yeah.
Very good. Right. So initiate the continuous cardiac monitoring. And also, I think the dysrhythmia takes more priority here
Really?
as well. So I need to look into this one too, right? So A and C is also my final answers, locking for this one. Now moving on to the question number 3, the one we have expected outcome. And they said only one select in here, expected outcome. It's pretty easy, I think. I think everyone knows the answer here. So let's see.
Yes, ma'am. A.
A, very
Reduction in
good.
chest pain.
Reduction in chest pain after the intervention. This is your more important expected outcome, what you're thinking in here, right? So this is the last style of the question for today's class. Now, when we meet together again next time, so those students who are wondering when is the next class going to be and at what time, probably same time. And just so you know, this series is going to be continue for next. So today in my Canada location, it was like Wednesday. So Thursday, Friday, Saturday, Sunday, probably until Sunday for next 3 to 4 days. It's going to be continuous until we finish the medication. Then I'll only take a 1-day break in between. Then I'll start the ECGs, electrolytes and everything as well. So yeah, that's the plan for the upcoming session. So those students who just joined, make sure either you join my WhatsApp. And my WhatsApp is also like group is getting filled up quickly. So maybe I'll make another group pretty soon. So if you want to join my groups, you can also get the link next time in the Zoom classes as well. And those students who are on the YouTube, if you feel comfortable, you can also watch on the YouTube as well, whichever works easy for all of you. Now, that's all about until here today, everyone. Any doubts, any question until here before we leave?
No, ma'am.
No? Okay.
No, ma'am.
How was the class, everyone? Pretty good, easy, difficult before we leave today?
It
Easy
was
to
very
understand, ma'am.
It was,
All good? All understandable?
Yes,
Okay.
ma'am.
yes.
Perfect.
All
Just want to
good
make
was it.
sure it's a little bit worth it, right? Okay, good. So thanks everyone for joining today. And thanks also on YouTube students as well for joining the lecture today. We'll see you guys almost same time tomorrow. Stay tuned for the next lecture. Thank you so much and have a great rest of the day and evening. Thank you.
Thank you,
Thank you,
ma'am.
Thank
ma'am.
you.
Yeah,
Thank
no
you, ma'am.
worries.